My name is Iman Osman and my country of origin is Iraq.
Madam, my name is Muhammad Salman Warsi.
My name is Mustafa Zahid and I'm the Director of Operations at Somali Family Service.
My name is Madeline Rubel and my country, I came from Philippines.
Hi, my name is Enrique Lopez.
My first name is Patrice Joseph Kamara. My country of origin is Sierra Leone.
My name is Nilda Perez.
So SHIFA360 is the workforce development arm of Somali Family Service. It started off as a health education platform. We noticed a hesitancy when it came to MMR vaccines and expecting mothers in the community. So we were thinking of creative ways that we can reach out to the refugee and immigrant communities because we noticed that there was a disconnect between them and some of their healthcare providers. So we created this VR experience, which actually was in a clinical setting in the language in a culturally sensitive and competent way where we can actually educate them on the vaccines and how they would actually be better for their families.
I am in healthcare, I'm a nurse, and I want to give back to the community in that way, so that's why.
I arrived to the United States with my family in 2011. So at that time, as refugees, of course, so I was helped by community health workers in many aspects. So I thought by joining the program, I would be able to pay back the community that helped me and help whoever needs my help.
Well, I was very much interested in taking up this community services because I have a little bit of background in this field down in India. And back in 1966, I joined health services, federal government health services, as a medical social worker and served there for 10 continuous years. And it was a very good experience, very fruitful, and I enjoyed that role of my profession. And it was inspired me to take up this course in America of getting up opportunity after many decades, and that's why I have joined this course.
I joined the program because I like to serve to the community, and it's my passion involving or helping the community to meet their goal.
I was invited to the program, informed by a coworker. And when I heard that I had an opportunity to learn how to help, serve, and reach out to the community, I was very excited about that. That's why I joined.
Two folds, actually. I'm a public servant. Okay, I've been doing a lot of services with the people, but in the wrong side of people. So when I hear about the program, I thought this is something that would give me some kind of to continue to serve people, to assist. I know there are some demographics, people that we can reach, and this will offer me opportunity to reach them, to assist them in every way possible. Yeah.
My biggest takeaway of the program is that I learned about this program, which is fast growing. I learned that this program is very fast growing program. And in this case, I can join many facilities like clinics, hospitals, managed care organizations. So I learned that this program is available for students with full tuition paid by the program. Also, in addition to the skills that we carry, which is linguistically, culturally, help the community that we will serve. So because there are many barriers that the community, especially like the minority, refugees, immigrants, when they arrive, they face many barriers. So by helping these members, we can provide advocacy to them. We can help them be active members in their community. So with the help that I got, I want to transfer that to the community that I will serve.
The biggest takeaway from the program so far has been an experience. Being in the same room with so many different people, different cultures, a diversity that I've never interacted with, and seeing them all very passionate about learning and how they are willing to give back to the community through their experience and understanding through their struggles, it opened up my eyes and I said, wow, I definitely want to contribute to this.
The biggest takeaway is learning about cultural diversity. This is very important to me because I embrace that workplace. Takeaway that you've seen that there are less privileged people that need assistance in any way possible. They are not able to afford, they look different, but we are one people. So the biggest takeaway is learning about diversity, being able to assist other population we can reach out.
The biggest takeaway that I have in this course is I able to learn a lot about different culture, the effect of culture to every individual, to the minority group, including myself. So I realized that like culture, our identity, and everything, it affects our daily life, our physical, as well as mental health. So I really focus on the way of the lecture that was given to us, and I able to learn how this history affect to the community. For example, like the African American who has experience in the history of this stigma, trauma, and then until now they still have that kind of issue in their life. And through this program, I able to acknowledge that the institution or the government must change some of the policy in order to help them. Like for instance, the disparities in social factors like education, housing, and also food security, health insurance, and other things that needed by the community. It's very unfortunate that the minorities, the community, doesn't have enough. So I feel I empathize for this, for them. So I hope something will happen for good. So the community, the people of minority will enjoy the life.
Well, it was a very good experience right from the first session of my class. And the faculty was very competent. I found them very helping. First of all, they were not horrifying experience. I felt comfortable in each and every class. And altogether, we had 10 sessions covering different topics of community work, and starting right from skills of the community health worker, predominantly focusing on that part.
There are so many takes away from this program. It's amazing. There's so many nice things that I can say about that. But if I have to say one thing, the most profound thing was learning how critical the community healthcare workers are and how vital their presence is in the community. in our neighborhoods.
Of course, I would highly recommend the program because, as I said, if you move from being a recently arrived refugee to an active community member, you need the first step to be taken. So this first step is taken by this program, the Community Health Worker Program. And I would recommend it because, first of all, as I said, the full tuition paid, including childcare, including travel. Also, because this program is provided according to your convenience. So it's either in person, online, according to your time. If you are working, if you have responsibilities. And of course, as I said, it is very fast growing program because of the increasing the diversity of the population recently. Also because of the prevalence of chronic diseases. So that's why, in this case, by taking this program, if you have medical background or if not, so in this case this program is providing for you an opportunity, a career opportunity, which is very helpful for others and for yourself, for your family, for your community at the beginning.
Yes, of course, because after completing the first session of this community health workers, essential of the community health worker part, so it was very, I increased my know-how manifold and particularly technical part of that.
I would definitely suggest this program to anyone who has the need and the feel and the want of giving back to the community, of being part of something big. There are so many people out there that require help, that require assistance. Coming to America or even being in America can be scary at times, and knowing that there's somebody out there that can help you and then being that person is amazing. I would definitely recommend it.
Definitely. I definitely would. I have learned so much. The instructors, the team, the entire team is amazing. From the lectures to the speakers to the activities that we've done, everything has been amazing. The teachers, they show that they care about what they're doing, and the curriculum itself is pretty holistic. It covers all the information that we need to become a community healthcare worker. And we go over so many information, not just the description of what we need to do, but also learning how important trust is in the community, learning about how we can be empathetic and caring. That's a major thing that came across from the team, was preparing us to go out there in such a diverse community with people with so many different needs. And we can go out there and help. And so the program itself, it's amazing. I learned so much.
Absolutely. I would suggest to other people who have already made it, because I'll give you one take. I went to Marin County recently. I found out that people waiting on the roadside, men looking for a job. They're good people, but you find yourself that you're fortunate. You thank God you're fortunate to get this position, and as well help other people. So the other things I would say that have really helped me understand who I am, my background, and able to relate to that also and assist other people. But in context of I don't think there's anything downfall of it, but at the same time, I think you need to expand a little bit more to reach out to other communities. Not only, I know this is southern San Diego County, so you have to reach out to other demographic in San Diego County as well.
First of all, I really enjoyed this program. I highly recommend it to others because you will learn a lot of things. It's very useful to our life and to others. So it's knowledgeable. The professor or the instruction They are well prepared, and the teaching is precise, systematic, organized, and there are some activity that students able to enjoy. And the class is well participated, and it's really a very good, enjoyable class. And I got a lot of things that I able to learn.
Yes, I definitely would recommend taking SHIFA360. The reason for that is because we're aiming not just for an education, but we're aiming for an education that's in demand. When it comes to some of our curriculums that we're offering right now, such as our community health worker curriculum, there's a transformation happening nationwide and even internationally for the healthcare system and the healthcare infrastructure. And community health workers are an essential role when it comes to that infrastructure. So at SHIFA360, we really pride ourselves on being ahead of the curve, on offering a platform and education that not only will train those in our program, but also will help them to be leaders in their fields.
This program has helped me grow professionally and personally. He has given me an immense sense of purpose and commitment to wanting to help out there. And it has taught me so much about the need that exists in so many, especially here in California, where we have so many different people coming from different countries. And I feel that this has helped me again. It has ignited a desire for me to help, and to everything that I have learned in the class, I want to implement that.
This program has impacted me in the most simplest way. I am so aware now that it doesn't take much. Tiny little bit goes a very long way. Just having the will to help and listening to people, being empathetic, it doesn't really take a whole lot. The program gives me a lot of skills that I know I'm going to use, and I know that they're going to be very useful. But the biggest impact has been that how simple it is to actually help someone.
The program impacted me. First of all, I want to thank the Somali family and the UCSD for having a chance. It's really great that I am in this class, this program, because it helps me to grow knowledgeable and impacted my daily life. For example, being healthy, being fit and healthy. Like actually, I'm diabetes type 2, but because of this program, it's able to help me. Now my sugar is being controlled, as well as my hypertension is being controlled. Now I feel happy, even physically, mentally. So all those that I learned from the school, I apply to myself. And I understand now some people with different culture, they have some issue in their life, and I able to be more humble and practice empathy. So I embrace the different kind of culture that we have in our life. So I really appreciate this program. It helps me to be a better person.
Oh, as a human, I has really have a great impact on my life, knowing my background, able to reach out. I know, like I told you, I've not been to this city, town before, but every day I thank God where I have been, what I've done in life. It could have been different, but I stayed close to school. It really inspired me to reach out to my people who are less privileged than me, and able to be there to assist.
Now I have developed a kind of confidence for future. If at all I get a chance to contribute my efforts and time in the development of health status of the community, I will feel proud of that. And by the virtue of attending this course, I have developed skills also. I mean, interviewing skills, then I was told about the role of importance of the community health worker, CHW as they call, and I mean, I was highly, I have become rather confident to handle the if at all I get a chance.
Actually, this program impacted me by opening a new world for me. As I said, I arrived to the United States with pharmacy background. Actually, I was a pharmacist. And it impacted me by helping me. So the community health workers, as I said, when I arrived, they helped me restore my pharmacy degree and be pharmacy technician instructor. So in this way, it made me like restore myself. So that's why I was thinking by helping the community back, I will pay off the community. And I learned that I can serve the community in many different ways, as you can serve in different job titles, like community aid, community health educator, and community health coordinator. So I can serve, I learned that I can serve the community in many different ways.
I want to say that this has been an amazing experience. I want to recommend it to everyone. I want to find out ways that I can share that this program even exists, that this opportunity even exists. I've been in the medical field for 15 years, and this is the first time that I hear of a community healthcare worker, and it's been an amazing journey so far.
It is very, very important because after completing this course, I came to know that in American society, it has a heterogeneous composition as a whole. I mean, people coming from different part of the world and coming and becoming Americans. So, and they are bringing different cultures from different corners of the world. So, I mean, they have a definite kind of concern about the health problems according to their own cultures. So I was told about the humility part of considering that culture and importance of that culture in terms of dealing with the health problems.
My comment is all are positive comments because this is really a great program. And I am very happy that I am here. You don't know how I feel. I cannot describe my feelings because I got a lot already, and it's very fascinating for me. So it's really great. I love it.
I would like to thank everyone who participated in the program for their efforts, for their time to make this program available for students, like tuition free. I would like to thank the instructors for I really value their insight and their guidance. Why? Because they wanted to graduate successful community health workers in order to serve the community better. Also, I would like to thank every one of my classmates because I had the chance in this program to meet with very knowledgeable classmates. So we learned from each other, we learned from our instructors, so as one team, but with one goal, which is make the community healthier.
I just want to say thank you for allowing me and selecting me to be part of this. I am so thankful. I can't say thank you enough. My experience has been wonderful. Our class was amazing. I met wonderful people, from the instructors, the team, the students. The class represented what San Diego is. It's a mixture of many people from different places. And so that was one of the things that I found most impressive. And I thank you again for giving me this opportunity.
SHIFA360 is a very exciting program. I know our learners really enjoy it. I definitely want everybody to keep an eye out for future curriculums and future offerings. We have a lot of exciting new programs that are in the works, and hopefully you guys will be hearing about it soon. I see the future of SHIFA360 being the head of the curve, being the first one to offer new education, essential education. I believe it will be the solution for some of the workforce problems that we're seeing, specifically in the healthcare industry. When the pandemic happened, there was a shortage of healthcare workers, and a lot of that was because there wasn't enough staffing that were educated in the right background. So SHIFA360 is really that bridge in between those who are looking for opportunities and also the facilities that actually need essential staffing.